There is new hope for those living with an aggressive form of leukemia. Dr. Guillermo Garcia-Manero and Dr. Gwen Nichols are here to discuss a promising new treatment option. Thank you so much for being with us.
Thank you.
Thank you.
Dr. Garcia-Manero, I want to start with you. How common are blood cancers and what makes them different from different types of cancers?
So leukemias are not that common. So maybe less than 5% of our patients with cancer have this particular disease. Acute myeloid leukemia is basically 1% of all cancers, around 20,000 people in the United States per year. It's important to stress that these are very diverse group of disorders with many different clinical manifestation, prognosis, and therapy.
And Dr. Nichols, what are the challenges that patients living with AML face?
Well, AML can arise fairly suddenly and require especially aggressive treatment and rapid treatment, so that getting good quality information for you or for your loved one is often difficult. You don't have a lot of time. And so finding resources so that you can learn the lingo and really understand the disease is one of the biggest challenges.
And can you tell us a little bit more about this new treatment option for people who have AML?
Yes, so over the last few years, we have seen a transformation in our ability to take care of patients with AML or acute myeloid leukemia. For many years, we had only a couple of modalities, and some patients could be cured with a stem cell or bone marrow transplantation. But over the last 5 years, we have basically developed multiple new compounds for our patients. This could be what we call targeted therapies that allow to treat very specific subset of patients. The last year, we've seen two major developments. One is a drug that blocks something called BCL2. This is a very effective drug in combination. And more recently, a drug that blocks or alters something we refer to as hypomethylation, a very common abnormality in AML, that is basically allowing us to maintain patients in remission for a longer period of times and therefore improve survival. This particular drug actually can be given orally per mouth, so this facilitates its use, and it's really a transformative approach that we have for patients with AML.
And what resources are available for people living with blood cancers like AML, and where can they find more information about them?
Well, there are lots of resources, and LLS has resources in whatever framework you need them for both you and the people who care about you. We have information specialists who are educators or social workers who will answer the phone at our 800 number and talk to you about how to talk to your doctor, what questions you have, insurance issues, any of the things that might be making things difficult for you. We also have really good quality information in pamphlets, online, in webinars and podcasts, you name it, whatever source you feel most comfortable. And really importantly, we can match you up with someone who has gone through this same process, someone you can talk to, no matter how good your doctors and nurses are. Talking to someone who's been through it is different, and that kind of support can be very, very helpful and important. So please feel free. And if you know someone with a blood cancer, not just leukemia, but leukemia, lymphoma, myeloma, have them contact us for free resources. And that can be found at LLS, that's Leukemia Lymphoma Society.org.
All right, doctors, thank you so much for being with us. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.